This Cincy Lifestyle Health segment, sponsored by Mercy Health.
My name is Nicole Eberle. I'm an ear, nose, and throat physician. I've been practicing at Mercy Health for about 4 years now. I practice mainly at Fairfield, but I'm also up at Kings Mills. I like Kings Mills. Everything is nice, shiny, and new. The staff is great. Kings Mills is in a convenient location. Patients who live in Mason, Mainville, Loveland, Morrow, Westchester, in the surrounding areas. I think there was a need for it in that area. As ear, nose, and throat physicians, we're surgeons of the head and neck. That includes the sinuses, that includes the throat, that includes structures within the head and neck, your thyroid, your salivary glands, also the ear. We're both a medical and surgical specialty. About 70% of my time is spent in the clinic. We do a lot of clinic procedures as well. And I'd say about 30% of my time is spent in the OR, doing procedure, all types of surgical procedures. We live in Ohio, we live in Cincinnati, the Ohio River Valley. There's a lot of allergies and sinus issues that come along with that. But especially around the winter time, you start to see more sinus issues, allergy issues get flared up in certain populations. Being indoors in close proximity to others, we're getting less fresh air, and being in close contact with other people, people often get sick in the winter time. Colds can turn into a sinus infection. Sinus infections usually are a little bit more longer lasting, usually take a little more time to resolve. Hallmark symptoms of sinus infections are extreme nasal congestion, yellow-green mucus drainage from the nose, forehead, facial pressure, and pain. The vast majority of cold and sinus infections are viral in nature and oftentimes will get better on their own. Don't typically need antibiotics for those, but when those symptoms stick around for longer, longer than 5 to 7 days is when I would seek the advice of a medical professional and consider antibiotic therapy.
I'm Dr. Nicole Besse. I am one of the audiologists here at Mercy Health. An audiologist is someone who works with hearing. So we test hearing, we work with hearing aids, we focus on the balance system as well. So we kind of look at the ear from a hearing perspective. In order to hear, we need healthy eardrum movement. So when we're sick, if we get upper respiratory infections, colds, it changes how our eardrums move, which makes a kind of temporary worsening of our hearing. I call it a blockage. So seeing either myself or one of the ENTs to help figure out how we get that blockage cleared can help improve hearing. So an important distinction between me and Dr. Eberle, or ENT, is I look at ears from a hearing perspective. So if you notice trouble hearing in crowds, that's a big one. Hearing in noise at restaurants, bars, churches, things just aren't as crisp and clear, could be a sign of underlying hearing loss. So coming to see me and have hearing tested is a great first step. Things like ear pain, dizziness, tinnitus, ringing in our ears, that's something that you'll probably see both Dr. Eberle or ENT and I for. Those things sometimes can have underlying hearing loss, so it's helpful to see both of us. At all of the locations, ENT and audiology work really closely together. So being able to walk down the hall and talk to our ENT and say, this is what I found, this is what I'm concerned about, before they go see the patient is really helpful.
One of the advantages we have at all of our facilities is that we have audiology on site. So patient comes in with hearing loss or hearing issues or ringing, we can get a hearing test that same day. From that hearing test, I can have a frank discussion with the audiologist, get his or her thoughts on it, and then make appropriate medical decisions based off of it. Anytime you get sinus inflammation, it can block off the eustachian tube. That blockage of the eustachian tube can cause negative pressure or fluid to build up behind your ears, feeling like your ear's full, maybe some muffled hearing, maybe a little bit of ear pain. And when that occurs, I would certainly seek the advice of your family doctor and ENT, especially if it becomes recurrent. When these symptoms become more recurrent, if you're having recurrent sinus infections or prolonged sinus infections, recurrent ear infections, would be a good time to see an ENT.